with Now webinar series. Here we are doing a series of webinar for mental health issues. We are bringing to you all the topics about mental health in order to destigmatize therapy and to normalize, all these mental health issues. And today this episode is dedicated to suicide awareness and prevention. I would like to start with this quote. The girl who seemed unbreakable broke. The girl who always laughed cried. The girl who never stopped trying finally gave up. She dropped the fake smile as a tear rolled down her cheek and whispered to herself, I can't do this anymore. Most of us, we know some or the other person who has gone through these kind of thoughts, someone known, or maybe ourselves sometime in our lives. We always go through these kind of thoughts when we feel like giving up, and these suicidal thoughts come to our mind. According to WHO, I have some data in front of me. It says close to 8 lakh people die due to suicide every year, which is one person every 40 seconds. Suicide is a global phenomenon and occurs throughout the lifespan. Effective and evidence based interventions can be implemented at population, subpopulation, and individual levels to prevent suicide and suicide attempts. There are indications that for each adult who died by suicide, there may have been more than 20 others attempting suicide. That's a huge number. And suicide occurs throughout the lifespan and is the second leading cause of death among 15 to 29 years olds globally. So it's not a small issue which we all are facing. And due to these pandemic and COVID, we see there is a rise in number of suicide cases. So today we have with us Ms. Ketki Sangvi, Masters in Social Work. She has experience of 12 years in the field of menstrual hygiene, child sexual abuse, and protection and prevention of suicide. She has been a prominent speaker and has educated preteens, teens, and adolescents on sexuality, hygiene, education awareness, child sexual abuse, and suicide prevention. She wears many hats besides being a doting mother of two. She is a trained dance movement therapist, somatic healer, graphologist, and an avid reader. Welcome, Ketki. Welcome to Heal with Now webinar series.
Hello.
And yeah, thank you. And before we start, I would like to introduce Ketki in another way also. She is a program manager for Sister Living Works. That's a non-profit organization dedicated to raising awareness and building advocacy for suicide prevention. The NGO was founded in Maryland, US, and has been functional in Mumbai, India since the last 5 years. Sister Living Works supports the goal of a better and safe society in India, where people are valued and where lives matter. We strongly believe that education is the first step in reducing deaths by suicide. And here we are because we also believe the same, that education is the first step. So
Yes,
welcome,
yes.
Ketki. Thank you so much. It's an honor to host you here.
Thank you for giving me this opportunity to be here.
Most welcome, most welcome. So, Ketki, I have a lot of questions, and I'm sure my viewers are also, they want to know a lot from you. So, first of all, I would like to start with you. This question, I want to ask this question: why there is rise in suicide cases? There's
Uh,
so and there is a lot of hype about like, oh my God, suicidal, and that there's a lot of stigma attached. Everybody talks to like, hush, hush, suicide, don't talk about it, don't even
Correct.
mention the word.
Yeah.
So what's going on? What's the scenario?
So exactly what you said, there is so much hush hush around suicide, and even Sisters Living Works was founded to break that hush hush around suicides. And I would say that suicides were always there. Now the reporting has increased a lot. Now people are aware that there are others dying by suicide, and there is a lot of increase in the report. And even when like Sisters Living Works was found, let me give you a brief of that. Our founder, she lost her sister by suicide, and when she came came back to India, she found a room full of people who are just trying to hush each other and show each other that don't talk about the cause or the reason of death. It's so easy to talk about if somebody is dying by a heart attack or a cardiac arrest, but it is not as easy if somebody is dying by suicide. So it was all hush hush, and she was in a very angry mode, upset mode. She said that, I need to break the stigma around this hush hush, and she founded this organization. And we also, now when we work in India with schools and colleges and communities to spread awareness on suicide, the first thing is, first answer or first reaction is, don't use the word S. Otherwise, our students, our community will get influenced.
It's
So I
like you're
want to,
implanting the idea of suicide into them,
exactly.
right?
And it is so difficult, to tell them that, we are trying to give education around it, and we are not encouraging anybody to die by suicide.
Mhm.
And your question is why it is increased. So there are so many reasons. There are so many causes. There are environmental reasons, like there is so much uh, stress due to family, stress due to dysfunctional families, stress due to relationships, stress due to billing or joblessness or financial issues. There are so many cases where suicide happens because there is a big unpaid loan or debts they are into. There is poverty, there is sexual abuse, there is stigma. So all these reasons are still there, and that is why there are so many deaths by suicide. It's almost 8 lakhs, as you said, around the world. In India, it is 1,35,000 almost every year,
Mm,
which is almost 17% of the world. So India is having this as a major public health problem.
mm, 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 mm,
There are other reasons also of suicide, like there could be historical reasons. So historical is, uh, let me explain you what is a historical reason. If, say, if my mother dies by suicide and I am also in the same emotional distressing situation, I will follow that. So
oh,
that is a copycat behavior or history of a person.
mm,
Then there are again individuals who have history of sexual abuse or physical abuse. Then there are other reasons, like exposure to this entire sensationalized, glamorized accounts of suicides. So nowadays we hear a lot that somebody is going on FB Live or say Insta Live or some social media live and dying by suicide. So others, youth and teenagers, try and copy that. And then entire pandemic situation has, of course, increased the risk in anxiety, increased the risk in mental health problems, increased the feeling of guilt and shame, and that is also increased to the risk of suicide.
mm,
Then there are health problems. Health problems could be untreated depression or untreated mental health problems. Like there is a WHO study which says that in India alone, there are almost 58 sorry I 58 million people suffering from depression. That this is what the WHO study says. And because of that, uh, entire stigma around mental health is so high that people don't want to visit a mental health professional or psychiatrist or even a counselor for even identifying if there is a mental health problem which they are going through.
mm,
There are again neurological disorders like epilepsy, which
mm,
it adds to the risk of suicidal behavior. Then there are terminal health problems like diabetes or skin cancer or traumatic spinal injuries or brain injuries or any injury or pain which is unbearable. Like we had a case here where this person, a 45-year-old man, he had earache, chronic earache. He was getting treated for almost 6 long months and he didn't find relief. And then a financial loss occurred in the family and he died by suicide. So
oh.
there are so many causes. There are generally 2 or 3 causes which work together when a person decides to die by suicide.
So it's basically an interplay of factors which work together on that individual, and when the person feels that that distress is quite overwhelming and
Hmm.
the pain is unbearable, and they feel the end is much easier than endure than to endure that pain. So
Yes.
must be so hard on that person who has to take that decision, right? Suicide. So it's not just one factor, but a combination of many factors.
Many factors.
Could be
Yes.
emotional, could be financial, could be relationship, could be anything, health wise.
Yes.
So it's a
Yes.
combination, and we cannot predict like, okay, A plus B is equal to C. It's not like
Correct.
that. So
Yes.
is it related to willpower, Ketki? Is it willpower, resilience, something like that?
Resilience would be there. Like I would say there is a lot of uh, right from upbringing also. See, mental health problem, if we know, say, like if I have a problem, if of say getting angry, or of say any mental health problem, if I have, and if I have started finding those signs in me, I have started recognizing this, my immediate thing is I need to go and seek help. So if I am seeking help, if I'm learning to understand that this is a preventable thing, this is a possibility that if I have my medicines, or if I have my therapeutic services in time, I will be okay, then it is definitely preventable. But if there are in some cases it's rigidity, okay, like they I don't want to refer, but then there is a lot of religious pressure. In those cases it is very difficult to uh, avoid that death by suicide. I'm not saying it's impossible, but if there is the person's mindset is rigid, then it is difficult to heal that person.
So there are basically certain risk factors involved, which predisposes you. Means if a person is of particular type of personality or have a rigid, mindset, they are more prone to these kind of thoughts and these kind of. Is
See,
it something?
usually there are three kinds of mindsets of a suicidal person. One is ambivalent mindset. So if
Mm-hmm.
the person is in a normal scale, if is in normal day-to-day life, but if there are trigger events, if there are traumatic events in the person's life, the person will start playing in that seesaw that I wish to die. Then there
Mm-hmm.
is a protective case or protective incident which occurs, and the person says, no, I don't wish to die now, I actually wish to live. So these are very ambivalent kind of person.
Mm-hmm.
Here the though there is a risk, but these forms of suicides are preventable very easily.
Yeah,
And if
because
we
there's
can
a
take,
dilemma.
it's a
You could take
dilemma,
it.
it's a dilemma, yes.
Yeah.
It's like a seesaw.
Mm-hmm.
And then there is another mindset, which is a impulsive mindset, which is impulsive mindset. So the personality is already very impulsive, and there is a trigger, say a very hard fight with a spouse, and there is access to any poison, and the person says, okay, now I want to die because my spouse is useless and my life is meaningless. And this is a very impulsive kind of a death. There are of course some other problems which already the person has and which person has not coped up with, and this is additional trigger to that entire lifestyle. And then there is third one, which is rigid. Rigid is difficult to handle. Rigid is, they keep on referring to, say, superpower, or it is a call, God's call, or something like that. Those are difficult to deal with, but they are not impossible. They need a long-term psychotherapy. They need long-term support to uh, unlearn their rigid thoughts.
Mm. So it's three kind of dilemma. It means three kind of stages: ambivalence, rigidity, and the third one you said one more like
The second one is ambivalence, impulsive, and rigid. There are
rigid.
three
So it's
mindsets.
difficult to control in case of impulsive. It's is it, but is
No,
it
so
preventable?
it is preventable. Definitely, impulsive is also preventable. So impulsiveness generally lasts for few minutes to few hours. So if we can support that person for those few
Mm.
hours, then
Mm.
and listen to them and try and understand their problem, or try and understand even their feelings, because where the mistake which we make is not validate feelings or not
Mm.
acknowledge the feelings. So if you are able to do that for few hours, then it's manageable. It's preventable form of death.
Mm, mm. So that brings me to my next question. Can it be prevented? So yes, it can be.
It
It's very
can
much
be,
prevent.
yes,
And
it
that's what
is.
we are doing. We are proactively taking actions, of bringing awareness about suicide, of the tips and techniques, how it can be prevented. So once we know that it can be prevented, I want to ask you how it can be prevented. Can we look for some signs in people?
Yes.
Yeah,
Yes,
in people.
there are definite signs.
Mm-hmm.
See, like, and as individuals, as say a layman, or as a friend or a mother or a sister, uh, what you can do is try and identify those signs. those are not impossible to identify. Like if there are direct warning signs, it could be, I want to kill myself. If
Mm.
somebody is making that statement, or if somebody is making a statement, I have a plan to kill myself, or I wish I were dead, I want to go and live with the stars, or what is the point of living if there are so many problems in life which I cannot handle? Why should I live? Or statements like, my families will be much happier if I'm gone. Okay. Or it could be, my life is unbearable, my problems are never ending.
Yeah, while
uh,
you're speaking, Ketki, I'm reminded, in South Asian, especially in Indian context, when we hear these lines, we brush it off. We say, "Hey, stop it! You are being melodramatic. Why can't you
exactly,
think about the positive things in your life? There's so much goodness in your life, and you're just stuck with that one negativity." So we
exactly.
try to brush it again and again under the carpet. Growing up in India, I have seen this a lot. We
Yeah,
never ever acknowledge these kind of thoughts,
statements. Yeah, and
right?
that is why, exactly. And then when the person dies by suicide, we say, huh, but usne, he had given me some sign. No, he
Hmm.
had told me that I don't wish to live, or I want to go to the stars and never be found again. So
Hmm.
we need to take these kind of statements very, very seriously. We need to ask more questions. If somebody is coming and telling that, I wish I were dead, then we need to ask questions like, let us sit and talk. What are your feelings? What are your plans? Why do you think that you are saying, you're making such a harsh statement? Because there are so many people who are happy because of you. So we need to have qualitative conversation as soon as we hear these kind of statements.
Hmm. So,
uh, then
hmm.
then some of the people would want to make indirect statements. They don't want direct statements. They might give indirect signs.
Hmm.
Indirect signs could be, like indirect statements could be, I am so tired, or I just want to be alone, I am having such a hard time in my life, I want I you know that I loved you always, right? Even if I'm gone, you will love me. Or will you miss me if I'm gone?
Hmm. So these are
Even
subtle signs.
these are subtle signs. These
Hmm.
are subtle signs, and there are few, Navroop, who do not give any of the signs.
Oh,
They
no subtle
they
signs
don't.
as well.
No, sorry, they don't. They give signs in the sense they don't make statements. They have behavioral signs,
Okay.
and
Yeah.
these behavioral signs are equally important to identify.
Hmm.
Behavioral signs could be, isolating from family and friends, completely staying in one room, just sitting all day doing nothing.
Hmm.
They don't even have motivation to get up and do daily chores like brushing the teeth or having a bath. Even
Hmm.
that becomes very difficult for them. Then giving away the treasured possessions, giving, in the sense, whatever affairs you had, they try to settle down those affairs. Treasured possessions could be like, I had a case here in Mumbai where this young 21-year-old boy, he never removed his jacket. In this heat of Mumbai, he would wear that jacket always, because that was his pride. And before killed himself, or he actually removed those jackets and gave it to his friends. He gave everything, all the clothes, all the money, whatever he had. He made small envelopes and said that this ABCD thing is for this person, or my headphones are for this person. So
Hmm.
trying to settle down affairs, or trying to give away the treasured possessions. So there
Hmm.
might be cases where making the wills and just dropping the will somewhere, giving away whatever you have. So that is a very important sign. Some people also say out clearly that I am going to die on 31st of October, say, and after that, ABCD things, you can take it.
Hmm.
Then there is writing songs and poems or letters about death, or how it feels to die. Uh, that is also, a sign of So it's not suicide note just, it is also before that. They start writing, they start expressing their feelings or their anger or whatever in a piece of paper. It could be their Insta post, it could be their stories in Facebook stories, it could be anything.
mm, mm,
Then experiencing drastic changes in eating and sleeping patterns.
mm,
uh, in the time of pandemic, lot of youth I am hearing, and there's some studies also that now they get up by afternoon and they are awake whole night. So this is like a drastic change in
routine.
uh, your daily pattern. um, Losing desire to take part in favorite activities. If it is a parent, they need to identify with their children that if they have stopped listening to their favorite songs, or if they have stopped playing the game which they love the most, they need to ask questions that why is this happening.
Mm,
Having trouble in thinking clearly. There is even the simple tasks, simple activities which needs thinking, they cannot do it because they're preoccupied. And then there are unexpected decline in any kind of performances. It could be for homemakers, it could be cooking. So
mm,
they cannot cook. The thing they did very smoothly for years together, they are not able to do that. And even as if there are feelings of impulsivity or apathy, there is no sense, no, there is complete numbness, feeling of numbness, there is anxiety or anger. All these are behavioral signs.
mm, mm. So what I hear is that there are a lot of cries for help. It could be behavioral, it could be verbal, it could be non-verbal, it could be the way they are acting. But the family, the friends, they have to be attuned enough to pick up those signs. Because
Hmm.
if we miss those signs, we can miss those cries for help, which the
Yes.
person is sending out to us. Ketki, these are the signs which a family and a friend can pick up if we are, very well attuned to the person. But
Hmm.
how about the signs? If a person himself is facing these kind of suicidal thoughts, then how do we help ourselves first?
First is, see if you're having any suicidal thoughts, and if you uh, call up call up helplines, talk to a person who you know will understand your feelings. uh, Ask, and if there is nobody to talk to, there are online help, WhatsApp helplines, there are, just pick up and just talk to somebody. Go to a nearest OPD or a mental health clinic and to ask for a counselor help, and try and control your impulsivity as much as possible. It is difficult, but it is not impossible. So if you think, if you need to calm down, you need to have those, it's that I will need to talk to somebody, I will need somebody, if you uh, to help me when I am in this crisis situation. Try and talk to somebody as much as possible. Try, it's okay to ask for help, and start telling yourself that it is okay to ask for help. The one mistake which a lot of us do is we don't ask for help. And asking for help is a lot of people have now started believing that asking for help is actually worst. It is better not to ask help but to die. But we are human beings, and it, for human beings, it's a social thing, and it, we will need each other.
Mm,
So it
mm,
is very important to convince yourself, and even to your children, train your children to ask for help and seek help.
mm, mm,
We run in Sisters Living Works, we run support groups for people who have lost their loved ones to suicide. And even there, we know that the person is not in the best of mental health conditions. We tell that, we encourage help seeking behavior among people.
mm,
We
mm,
need to start spreading this communication within our homes, that uh, let's work on this together.
mm, mm.
So just seek help, ask help, and uh, it could be pick up a phone line, pick up anything, call up somebody, WhatsApp somebody, or just walk down to the nearest mental health clinic or whatever is available.
So if one is feeling suicidal and we are having, if you are going through pain and it's distressing and overwhelming, Always remember that resources are available in the community, be it in the form of helplines or mental health community centers. You can walk in there, or if you still feel, there's a kind of embarrassment attached to it, you can call at least one person whom you are close to and just talk. Just talk
Yes,
in that moment, because it's just a moment. If it passes, you are on the other side, you are on the
right.
safer side, you're on the life side, because there is a continuous dilemma, which is life side and the death side. So in that impulsivity, you might jump to the death side, and you might, you know, the death may not, it may not culminate into death, and there may be multiple injuries which you might be regretting. And so it's better to always acknowledge your feelings, and then try to think that it's not the end of the story. It might be just a bend. And right now, in my distress and in this pain, I'm not able to see beyond this thing. But definitely solutions are available, and help is available in the society too. So if you're not able to afford it, or if there is any issue, you can reach out to our platform, Heal with Nav, or we will be flashing Ketki's number also. Sister Living Work is very actively working about this. You can reach out to Ketki online also. We'll be flashing her numbers. And so, having said that, there are resources available in the community, and you can have access to that. And if you have these suicidal thoughts, definitely seek help, and keep numbers handy, especially
Yeah.
on your speed dial, so that if you are in that moment of impulsivity, you can at least click that speed dial number, and you may, you may be out of that impulsive span of time in that this short moment of time. So,
Just I want to add to that. People who die by suicide, they want to end their pain. So if there is any way you can end that pain, see, it could be temporarily that you can end the pain, but there will be permanent solutions to that pain. So death is not the permanent solution to this temporary problem. All the problems are temporary.
yeah.
So just try and focus on these problems, and remember that all of them are solvable.
Hmm.
The time may vary, but they are, all of them are solvable.
Yeah, yeah. And suicide is not the solution for that.
Yes, yes.
It's a temporary, you think it's a permanent solution, but it's not. You may leave behind lot many people who might
Yeah,
be, in not good state about that, and you might yourself regret it, while in doing it also.
yeah.
So better, seek out help. And I want to know, Ketki, there is one more thing which I was very curious about, like how to talk to someone who is suicidal. Like, we know, all of us who have joined us today and who will be watching us on Facebook Live, we all know at least one person who has committed suicide in our lifetimes.
Hmm.
All of us, no matter anyone, of any age. So it's so common, it's so prevalent. So how do we talk to someone we feel that this person is suicidal, and we are able to pick up the cues, we are attuned to him, and probably we see those cries for help. So how do we talk, and how do we approach that person?
First is, as an individual, you need to be calm. Okay, you don't need to be very hyper or angry or get confused. Okay, it is okay to be confused, but at least don't present that body language, that vibes to the person whom you're going to talk to. Ask the person if the person is suicidal. If you're picking up cues, if you are hearing those little statements, if you're able to read between the lines, ask that person, are you thinking about suicide? Are you thinking about killing yourself? If the person says yes, ask more questions. If the person says no, even if the person says no, there is no harm in asking the question.
Yeah, at
um,
this point, I want to clarify, Ketki, because this is very, very important for all our audience. We can ask, right? We can ask
yes,
directly. We
you
can ask
can ask
directly.
directly if you are confident, if you are able to, if you're ready to listen to the answer, yes or no, whatever. And if you have enough resources, if you have enough, gathered enough knowledge, information, even for the simplest thing, like if the person asks, okay, I am suicidal, what do I do? And you should have those few phone numbers ready with you, few helpline numbers ready with you, if you're not prepared to,
Mentally prepared.
yeah, if you're not mentally prepared.
That
So
to journalism.
yes, it is. And a lot of studies say that it is important to ask this question because it will open two-way communication. till now that person is still in the zone of mentally confused, not able to understand what to do. And as soon as this question pops up, the person starts realizing that somebody is watching me, somebody is caring for me, somebody is asking me this so directly. That means that I am wanted, I am feeling loved.
I'm valued and I'm being
Yes,
cared for. Yeah.
yes.
Yeah.
So ask that question. And no matter how difficult you feel, but it is just a moment where you will find it difficult. As soon as you start opening up the conversation, you will, you know, uh, as a as we say that, believe your gut system,
That feeling.
gut feeling, believe it. So as soon as you start answering, you will start asking questions, you will start getting the right answers.
Mm.
And even if you don't have the 100% right answer, tell that person that I don't have the right answer for you right now, but let's sit and talk, let's understand what's causing the pain, and let's try and address those pain areas.
Mm. Mm. So
So
it's basically sitting with the person, journeying with them, listening to their story, and
yeah,
giving them that space, that unconditional positive regard, and that
yeah,
space where they can open up easily, right? They feel
yes,
safe
yes.
about it to
And
talk to us.
when the person is also talking, listen without judging,
Yeah.
listen without comparing, and
Mm.
listen with all the heart.
Mm.
One thing is, we always try to compare that A's life is worse than yours. A is still alive. Why are you attempting? We make these general statements, but listen without judgment.
Mm. Mm. Yeah, because
And acknowledge, sorry, you were saying
yeah,
something?
because this devalues the person, that okay, you are not valuing me, you're putting me in the other place, and you're telling me, comparing my space, you don't
Yeah,
even know what I'm going through,
exactly.
you don't
Yeah.
understand. Yeah.
Yeah. So just listen without judging. Acknowledge the behavior, the feelings. The person might be very angry. The person might be really irritated. The person might be numb to a situation. But acknowledge. We can say statements like, it is okay to feel angry about it. If I were in your place, I would have been also angry. But uh, let's try and find ways to reduce this anger.
Mm. I see.
So ask the person as many as questions you can without, and also the questions, when you frame them, avoid framing judgmental questions.
Okay, can you
Okay.
give some examples for judgmental question? How do we sound when we are judgmental?
Um, Let me give you an example. Judgmental question could be, um, okay, it's not immediately coming to my mind. Let me come back to
Yeah,
this.
so yeah, probably, why are you thinking like that, or you have all good things in life.
Yeah, so if you have, this is the exact thing, like you have all the good things in life, still you want to die.
Mm.
What will happen to your children?
Look at the
will
positive side.
will children have good impact when you die? Or
Mm.
won't people laugh on your children when they go to the world and say that my father died by suicide? No,
Mm.
these are judgmental things. Right
Mm.
now the focus is that individual. The focus is how we try and calm down that person so that the person doesn't take the step what he has planned.
Mm. Mm.
So don't compare or don't judge the person for whatever behavior or whatever feelings the person has.
Mm. 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 So these are
Then
the certain things which needs to be avoided, right?
yeah, these needs to be avoided. And also debating whether suicide is right or wrong. A lot of people get into this argument when the person is in distress, when the person is on the say terrace and trying to jump, and this is wrong, this is sin, this is, don't get into those kind of statements. And that is why even we say that we never say it is committed suicide. We say people die by suicide. Committed is a crime. We commit a
Mhm.
murder or commit a robbery, but this is dying by suicide. We don't say that somebody committed a heart attack.
Yeah.
Okay, though we know that the lifestyle was such that the possibility of heart attack was there, but we don't say it committed a heart attack. So similarly, we try and say it is die by suicide, not committed suicide.
Mm.
And also discuss the feelings of person, they are good or bad. In pandemic situation, a lot of people might be in the worst feelings. They might be really feeling bad because of loss of job or whatever, loss of, or staying together in the families. Many people are finding it very difficult, but don't compare those feelings are good or bad. In the same situation, we might feel differently. So avoid comparisons and lecture the person on value of life, as we said before. Don't, in those situations, don't get into those discussions. Even I would like to add here that start making a care plan for that person.
Mm.
How do you make a care plan is let the person know and understand that you're caring for the person. The caring could be through different little,
Verbally.
yeah, you tell that person, I care for you, I understand, but probably I am not the only person who is going to help you. Together we can work around on a plan for you. uh, then maintain good eye contact with that person. Give a very positive body language to that person. Make that person feel loved and cared for.
Mm.
Or as you said before, make the person feel valued.
Mm.
uh, and again I'm repeating, listen without judging. That's
Mm.
a major thing. And don't encourage the person to do it. No, in anger, when both people are in anger, they say, okay, somebody says I'm going to kill myself, and the other one will say, yes, go and kill yourself. That will be the end of this, and all the problems in our life will end. So don't encourage, even in the heated arguments.
Mm. So even in the heated arguments, control your emotions,
Yeah.
control your what is coming out of your mouth. You just can't say
Yes.
anything. Yeah.
Correct. Correct. And act shocked. So as soon as a lot of people ask this question, are you suicidal? And when they answer the answer yes, they will be shocked, or they'll be frozen. I don't know what to do next. Those things don't at least put. Of course, even as a mental health professional, there are counselors also who, when the person walks in their room, they could be shocked, but they don't show in their body language. So you also, as an individual also, we can do that don't show this shocked behavior, expression of yours. And then treat the person. How do you treat? Treat is definitely find a mental health professional. All of us are not equipped to uh, uh, handle a very sensitive case. So
Mm. Mm.
find somebody in your local area, find somebody through connections, but find somebody.
Mm.
And don't leave the person alone. Even if the person is, banging and saying that you get out of the house or get out of the room and leave me alone, don't leave the person alone.
Mm.
The person is in extreme distress, and in this there could be impulsive. If whatever the person sees, sharp objects or lethal substances, the person might harm himself or herself. So don't leave the person alone. And also, a lot of people have this, I'll keep this a secret. Don't get into
Mm.
that secrecy,
Mm.
because it is a matter of life. We may have to seek support from a lot of people. So don't keep this as a secret. Then this is like a very on the first hand intervention kind of thing. But
Mhm.
even within the houses, we need to start having communication about mental health.
True.
Like, I read an article recently where they said that we are talking so much about mental health on social media, but at home, nobody wants to sit with children and parents. They don't sit together and talk about what exactly is mental health.
Mm. And
It's
why
not,
it's important. Yeah, I know the
yes.
importance of mental health, how
Yeah.
important it is.
So even if we are reading something, say recently we are hearing a lot of celebrities dying. Take that as a moment. to talk to your family about what will we do if somebody in our family is trying to attempt. Start having those conversations within the house, because that will also encourage help seeking behavior. That will also encourage that mental health problems are common, and even if it happens within our society, we will try and address it in a proper way. So start bringing those conversations to dinner tables.
True. So initiating conversations and normalizing, seeking help.
Yeah, normalizing help seeking behavior.
True, true, true. At this moment, I would like to encourage all our participants. If any one of you wants to ask any question, you can probably put it in the chat box, and I'll bring it forward to Ketki at the end of the session. We have few more minutes before we end, so probably if you can start sending your questions to in the chat box. Meanwhile, Ketki, I would like to, know more about how Sister Works Living Works is working in India and how you are helping youth, adolescents, and teenagers about being means you are educating them proactively about suicide and what all you are doing there in India. Can you?
So in India, we have two kinds of work. One is educating masses on suicide prevention, and A, suicide prevention, and B, also spreading the awareness. So we are educating a lot of people. We have different set of modules, a different module for a college student, college group, a different module for professionals, and we have a 4-day intense module for counselors on how to work or how to handle cases of suicide.
Oh, okay.
So that's a 4-day module we have. And training is our big chunk. It goes in trainings. Then we have virtual runs, or we have conferences year on year where we bring academicians or professionals together and talk about different strategies which will work in their forums on suicide prevention. So that we have yearly. Then we have Into the Light event where we encourage running, of and where we talk to people about how exercising is also helping uh, your mental health, and how exercising is very important for mental health well-being. So that event also we have. And then we run support groups for people who have lost their loved ones to suicide.
Mhm.
uh, we encourage them to come and talk to us, share their feelings, and if needed, we also refer them to therapeutic services.
Okay. So we refer them to therapeutic services also, and there can be medication involved also in people with suicidal tendencies. So there is no, shame, and there is no harm, and there
Yes.
is no bias or prejudice in. Don't feel embarrassed about taking medication. It's quite common, you can calm
Yes.
your nervous system down and probably, and then therapy can help. I would like to mention at this stage that in Singapore also, SSI is doing a few courses, applied suicide intervention skills training, wherein for social workers, counselors, psychologists, and students, and especially the volunteers who want to work with people in the space of this people who have suicidal thoughts. So do check that out too. And I have few questions in the chat box, Katie. I would like to read it out to you.
Yes, please.
One is this is sorry, yeah. Does meditation or something to calm down these thoughts helps?
See, it will help a bit. uh, any form of exercising will also help, but I would still say that if there are thoughts, seek a mental health professional. Just by and again, we have in India and around the world, I would say there is a lot of stigma associated to it, and a lot of uh, people go back to the faith healers to if they have any mental health problem, they go back to faith healers. But we will still say that all exercise and everything is useful, but don't neglect the medications if they are given to, or prescribed medications. They are very, if they are given, please take them uh, with dedication.
Yeah.
treat your mental health the same way you will treat the physical health. So if you
right.
were given a medication for any physical ailment, you would take it very religiously. Do the same thing with the mental health medications.
Yeah, I would like to add to it that this is a very good question, that does meditation or something to calm down these thoughts helps? Yes, it very much helps. We have in trauma two approaches, top down and bottoms up. So meditation actually calms your nervous system and bring these thoughts down. It calms down your body, it calms down your nervous system. Apart from meditation, you can do deep breathing. Whenever you are having such thoughts, you can go for deep breathing. Yoga, it helps a lot. There are certain hip openers exercises which can help you. And if means, see, there are two kinds of interventions. One is crisis intervention. Crisis, like impulsivity, like as Ketki mentioned, you have to immediately seek help from the helpline, go to a mental health therapist, go to the hospital, seek help, medication, therapy, whatever. That's the crisis situation when you're exactly having those thoughts. But if you are starting to have these kind of thoughts, and these are just the beginning, and there are distressing thoughts, probably yoga, meditation, deep breathing, having cold showers, it definitely helps, because it bring down your nervous system, calm down your nervous system, and definitely calm down these thoughts also. And there is one more question: how to deal with the person or situation if he or she continues saying in every problem, do whatever you want to do, whatever you think, it doesn't matter to me, rather than bringing rather than having that clarity or understanding. So I think the question is that if I
It's
am
very
being
rigid.
suicidal,
Yeah.
if I am being suicidal and I have suicidal thoughts, and the person with me keeps telling me, go ahead, I don't care, what do I do?
I would say that you care for yourself, and because you're aware about your thoughts, try and get access to different resources. Try and even don't talk to a person who is probably not valuing your feelings currently. Talk to a person who values your feelings.
True.
Okay. Talk to, you don't need to always tell everybody that I'm seeking a mental health support. You can do that in secret if you don't feel encouraged in no, if you don't feel comfortable enough to share it with the world, but you know that it is important for you, seek help.
Hmm. And you matter. You definitely matter. You are valued. You are
Yes.
important. Please take care of yourself, take care of your mental health, and seek
Yes.
professional help. So,
Yes.
even if the person who is staying with you is not able to provide you, you yourself provide it for yourself. You go
Yes.
and
Yes.
seek mental health for yourself.
And if one is not aware, say one is being extremely rigid, like we had a case here where these parents they didn't allow the daughter to take the medicines which were prescribed by a psychiatrist because daughter was having depression. But there was a friend, and she said that, even if your parents are not allowing, when you come out for college, I will give you those medicines. So they're they they had tried a lot, but this was an alternate strategy which they came up to, that if parents are not listening, let us do it, but you need some support. So you need to find out somebody else who is going to support you.
And there is one more last question, which is, may I ask, how can a nurse overcome the guilt if she has lost her patient to suicide?
um, this is a very difficult question to answer. um, Actually, it needs a lot of work, because overcoming guilt in any form is a difficult thing to do. It is not impossible, but also we need to draw a line somewhere, that after so many tries also, we need to prioritize our mental health. um, like, a lot of people ask this, that mental health practitioners themselves are now getting exhausted, what do they do? So please take care of yourself, and even if you have said no to somebody, don't get into that guilt, that I said no when somebody was asking for help. Don't into get uh, don't get into that guilt. uh,
As Ketki mentioned, it requires a lot of work, and you did your best.
yeah.
Once my supervisor told me while I was in training, my supervisor told me, you wouldn't be able to save each and every one. So
Yeah.
you try your best, whatever you can, whatever is in your capacity as a human being, but still there might be a case where you won't be able to save that one person. So it's okay, we all are humans, we all did our best, but after a point we just leave it, to
Yeah.
God, to faith, to universal power, and we do our best. So I'm sure you are having this trauma and it's very difficult for you. It's painful for you to get over this guilt because you were attending to that patient and you were taking care. And maybe you might be asking yourself, maybe I missed those cues, those cries for help.
Yeah.
So I would request you to seek some professional help, maybe therapy, process this trauma, process this pain out of your system. It's very much doable. So that's it. And thank you so much, Ketki. We don't have any more questions, and this was a wonderful session. Thank you for joining us today from India. And I know you are in the middle of so many things, personal things also, and still you came here and helped us. And I would like, Ketki, please mention your email ID and your phone number probably in the chat group, so that if any one of the participants wants to contact you directly, they can do it. And
Yes.
we are also there on all social media platforms by the name of Heal with Nav. You can check it out on Facebook page. You can check us out on Insta handle. The name is Heal with Nav. And thanks to each one of you for coming today and showing up and making this place, making this world a little bit better place by proactively taking part in this community services, whatever we are doing a little bit. I I I like to call it think globally and act locally. So whatever small bit I can do, and by the way of Heal with Now webinar series. Thank you very much for
Thank you.
listening.
Thank you. Thanks a
Thank
ton,
you,
Navroop.
Katie. Bye
Thank
bye.
you. Bye.